This is Dr. Sonia Dhoot, and you are watching this video because you have been diagnosed with dry macular degeneration. Macular degeneration is a condition that tends to run in families, and the chances of developing it go up as we age. We don't usually start seeing evidence of it till at least the age of 65, and often is diagnosed even later. Macular degeneration basically means that the macula, which is responsible for our central vision, is aging faster than we are. There's two types of macular degeneration. There's the dry type and a wet type. The dry type affects about 85% of people, and almost everybody starts with dry macular degeneration. Dry macular degeneration is kind of like the tread on your tires. It slowly gets worse with time. There's about a 10 to 15% chance that at some point in your life, one or both eyes will go from dry to wet macular degeneration. And if that happens, it's like running out of gas. The vision gets worse quickly. If the macular degeneration goes from dry to wet, we need to diagnose it and start treatment right away, because the sooner we catch it and start treatment, the better the prognosis for your vision. For that reason, we give you an Amsler grid and ask that you check the Amsler grid about once a week with each eye, one eye at a time. With both eyes open, sometimes people don't realize they have a problem because their good eye compensates. But usually by covering one eye and then the other and isolating one eye at a time, you're usually able to figure out if things look different. We know smoking makes macular degeneration progress much more quickly. So if you do smoke, very imperative that you stop smoking to reduce the chance of significant visual impairment from macular degeneration. We also recommend you start taking an AREDS2 formulated vitamin. Preservision and Ocuvite are two of the most common ones, and they're available over the counter. Costco and Sam's Club tend to have a pretty big bottle for cheap, and that's usually where I recommend patients look for the cheapest option. Taking the vitamins, we know, reduces the chance that the dry macular degeneration turns wet by about 30%. They are vitamins that are taken over the counter and two orally every single day. We are also going to give you a packet to go home with that has some dietary recommendations of things you can do to eat and be healthier so that you can limit the amount of toxins in the body for macular degeneration. There is also a remote monitoring system that will allow me to monitor your macular degeneration remotely. It's an Amsler grid like the one we're giving you, but an electronic version that you take about once a week with each eye. It takes about a minute to do, and it's covered by insurance. And that way, even though I'm not seeing you for 6 months, I'm still able to keep a close pulse on your macular degeneration. And if anything gets worse, we would alert you to come in sooner for your appointment.